A surgical team from Kenya, consisting of 15 persons, traveled into the western part of the Democratic Republic of Congo to a town called Bandaka. Their mission here was to treat as many patients as possible suffering from birth defects that affects a person's upper lip and mouth throughout life. This condition is known as cleft lip or cleft lip and palate. There were also what is called VVF, or vesico-vaginal fistula, which is a defect that causes leakage of urine from the bladder into the vagina and causing much distress to the woman so affected. We follow the team and a young patient during their time here.
My name is Fondo. I am from Kasa. We are living in the house of our grandfather. He has died and left us this house for inheritance. I am studying in BMS in 6th form. I have 14 years. In our family we are 10. We was 11. One of us has already died. In my family, nobody has a cleft lip, only me. In my area, I don't know somebody who has this disease. In our family, we are 10. We was 11. One of us has already died. In my family, nobody has a cleft lip, only me. In my area, I don't know somebody who has this disease. In my classroom, I'm not loved. Everybody is making fun of me. The weakness of my disease affects me too much, so it affects my class. I can't start very well. Sometimes I'm running away from the school.
Every patient is required to go through a screening by the anesthetist before being able to be operated. We asked one of the team's anesthetists about this process.
I'm Michael Mondi, H.C.F.T anesthetist. I'm working now with the organization for Help a Child Face Tomorrow. That is the Operation Smile, mostly dealing with operations for cleft lip and palate. The cleft lip usually will start by mothers during a child when he is in utero. That's when the child is still in the womb. That we call them the fetus. Usually the mothers, they forget to go through checkups. We call it maternal profile. So because of that checkup, mother does not take the necessary minerals required. Like for example, mothers when they are expectant are expected to take folate and ferrous sulfate. So folate basically helps in the neural development. When the folate is deficient, usually the neural development will have a problem. So the patient, the child when is born, will end up getting that cleft lip. So it's an abnormality got during birth. So cleft lip is an opening on the lip of patient. Usually it's on the upper lip of the patient. So the lip can open on one side, which usually called unilateral, and the lip might also open on both sides or extend to both sides. So we'll call that bilateral cleft lip. And if it has extended everywhere, we again call it complete bilateral cleft lip. And when it is not going to the whole side, we'll just call it incomplete cleft lip.
When a patient has been screened and tested by the anesthetist and is found fit for operation, He or she is then handed over to the surgeon to be operated upon.
My name is Dr. Meshack Nyamiaka. I'm a reconstructive and maxillofacial surgeon associated with Help a Child Face Tomorrow, which is a charitable organization that takes care of people, children and adults with facial deformities, with a special interest in cleft lips and palates. We find that the best way of solving this problem is to take the services where they're supposed to be and where they are most needed. Bandaka is in Equatorial Province, a very forest area. The only means of transportation for most of the people is through River Congo, through the boats. But to reach where we were, they will take about 5 to 6 days on board. The other unavailable modes is through air. Even that air doesn't go to most of the places, but it depends on very small planes of the UN that normally will be able to go there, which will bring about 5 or 10 patients. But you can understand the difficulties in terms of the expenses that are supposed to be there. In areas, when we work out, we find that the cost per patient, when we do these kinds, it comes to about $800 per patient. When we put everything, worked on, the transportation, the drugs, the equipment, on a case that normally would cost about $20,000 in high-scale institutions or special centers, you can see that what impact it has got.
I am Dr. Khan. I'm based in Nairobi, Kenya. I am a dental and oral surgeon. I am on the training program with Meshack. I'm learning the maxillofacial cases because I understand on the ground, anywhere in third world country, maxillofacial cases is the biggest challenge in the health sector. Very few maxillofacial surgeons, very talented maxillofacial surgeons in this world, and the people are suffering on the ground. Wherever we go in different countries for the camps, for the mission, we found a lot of maxillofacial cases untreated. So that is the biggest challenge on the ground in third world country. When I was coming by aeroplane, some UN officials sit next to me is asking, where are you going to? I told him I'm going to Bandaka or Congo, DRC Congo. And he told me which hotel you are living. I said, I don't know. Who is giving you electricity? I said, say what? Electricity what? Who is giving you water? I said, why? In the hotel. So he said, this is the biggest challenge over here, electricity and water of this country. There's no electricity in this country. There's no water in this country. Fine, when we come here in this hospital, I was talking to Meshack and telling this is a hospital, this is a cell. It's like a jail in the prison. The same thing, it's a darkness everywhere. Our whole team is cleaning the things and everything. So challenge to work in Africa is every step is challenge. Everywhere you go is a challenge. Everything you think is a challenge. Everything you do.
The hospital that we worked in had nothing. There was nothing that could resemble an operating room. There were no drugs. There were no equipment. There were no theaters. There were nothing was available. All in all, we carried and we operated on 100 patients. Despite the difficulties we had in terms of transportation, it's very expensive. Just traveling to Bandaka costed us almost $10,000 on travel alone. Accommodation on the ground costed us a lot of money. But that cost is worth it of the result that was achieved. If we face those challenges and we did some work. But now we have created more demand in that area. Many people now realize that yes, this can be done there. There was more need and more demand for us to do such things, but we couldn't be able to do that. We are now appealing for us to be able to get more funding so that we can be able to go there, maybe in October, September, to help those who didn't have.
The hard work and efforts put forth by the surgical team are good, and these are thoughts about the future.
If we continue like this with these volunteers, dedicated volunteers, look, go and see these nurses, the way they are sweating and they are changing a bush to a palace. is a great dedication, and that is our volunteer. That is our power of the organization. If we dedicate our life like this, the future is very bright.
You know, when you have changed someone's life by offering that surgery they have been needing for many years, or for the children who have been born, and you are trying to change them so that at least they can be able to face the world, and they can be able to do the duties tomorrow, they can go to school without being teased around, they can be able to, if they are adults, they can be able to go back to work and generate income and increase the per capita to the communities. You change their lives completely. You actually involve, you get them to be involved in their own lives so that now they don't have to be hidden, but they can be able to help. That's what the future is supposed to be. You will remove the huge burden from their lives, the families, the communities that are supposed to be there. We are teaching them how, in those facilities that they have got, how they can be able to improve in terms of doing safe surgeries, in terms of taking care of the patients, in terms of increasing their capacities. I think this is what is going to change the world.
The Help a Child Face Tomorrow team operated on over 70 patients during the 2 weeks in Bandaka. It takes 1 or 2 days for a patient to recover after an operation. They are given a talk on wound care, hygiene, and nutrition by the team nurse before discharge. El Fondo recovered well. We hear her final words on how she felt.
So she said that she is very, very glad to have her face transformed. Okay, she said that she thinks that his life will improve, and what she will be doing now, it will be to praise God, because it's God who sent this team here in order to help her in transforming her face. Yeah.